Food addiction is a very common problem. I think a lot more common than even the research is showing. Your body and brain will change its chemistry to try to deal with that stressful situation. In my view, the hallmark of attention deficit disorder is executive dysfunction. You can't feel the pain of brain inflammation. Instead, what happens is your mental health will suffer. Most people now around the world are eating foods that no longer come from farms and fields and fisheries. They come from factories.
How much of psychiatric illness is genetic and biologically driven, and how much of it is our lifestyle? Dr. Georgia Edie is a Harvard-trained board-certified psychiatrist and world expert in metabolic and nutritional psychiatry. Dr. Edie, thank you very much for being with us today, and thank you for accepting the invitation.
It's really wonderful to be here with you. Thank you so much for inviting me.
Thank you. And my first question is, what is nutritional and metabolic psychiatry?
So these are two very brand new fields, subspecialties of psychiatry. Nutritional psychiatry is focusing on dietary quality, how the quality of our diet can influence our mental health. And then metabolic psychiatry is how our metabolic health influences our mental health. So our metabolic health, there are many pieces to that, but the fundamental pieces that we pay attention to are glucose and insulin levels.
And are there signs and symptoms for insulin resistance in the brain that would show as a psychiatric illnesses?
Yeah, so insulin resistance is a pandemic at this point. Most places around the world, at least half of people have some signs of insulin resistance, and in many places, much higher. Most people around the world, their glucose levels are running too high, their insulin levels are running too high because of the way we are living our lives, especially how we're eating. And when the insulin levels are running too high, you can develop insulin resistance, not just in the body, but also at the blood-brain barrier. And so what happens then is that when the brain becomes insulin resistant, glucose can still cross easily into the brain where it is needed for fuel. The brain does need some glucose at all times. It doesn't need very much, but it does need some to function at its best. But the problem with in people who have insulin resistance is that it becomes harder and harder for insulin to cross into the brain. And the brain cannot process glucose properly without adequate insulin. So what you get is this situation where you've got plenty of glucose, but not enough insulin to use that glucose properly. And then the brain starts to run low on energy. The more we look for a relationship between poor metabolic health and poor mental health, between insulin resistance and mental health diagnoses, the more connections we find. So, for example, with serious mental illnesses like schizophrenia, bipolar disorder, major depression, these conditions, insulin resistance and these diagnoses, are very commonly seen together. So if you have one, then you're about 3 times as likely to have the other one. And that's a big connection. 3 times more likely is a very strong connection. And then there are even some studies now demonstrating that if you can reverse insulin resistance, so for example, in bipolar disorder, there was a wonderful study conducted by Dr. Cynthia Kalkin, a bipolar expert, showing that if you could reverse insulin resistance using metformin, a medicine that can reverse insulin resistance, if you could reverse insulin resistance with metformin, those people with treatment-resistant bipolar depression got better. And so this demonstrates that insulin resistance is playing a direct role in the severity of depression in people with bipolar disorder. And this is just one of many studies that is starting to help us understand this very tight relationship between our glucose and insulin levels and insulin resistance and mental health.
Could you talk to us about chemical imbalances and also what causes chemical imbalances in the brain?
I love especially the second part of that question. So I was trained and people still are trained around the world, physicians and other medical practitioners, that mental illnesses, the biological root causes of mental illnesses are related to chemical imbalances in the brain. And these are the ones that we usually hear about are serotonin, dopamine, and norepinephrine. There are these three molecules in the brain that people have been thinking about since really the 1950s, when the first medications in psychiatry for depression first became available. And so we've been focusing on those three molecules in the brain for over 75 years. So it's not that these chemical imbalances don't matter. It's not that they play no role in mental health problems like depression. It's just that the role they play is rather small, and the medicines that we use to target those molecules don't work very well. So we're clearly missing something important. And one of the reasons I do the work that I do and that you do the work you do is because if you look deeper to try to understand, okay, maybe there are some chemical imbalances and maybe they play some role. Okay, well, why? What's causing those chemical imbalances in the first place? And when you look deeper at the metabolism of the brain, glucose and insulin levels and inflammation and something called oxidative stress, which can be very damaging, those are the things that are driving a lot of those imbalances in the brain. And if you correct your metabolic health, which is actually you can do very quickly, when you improve your metabolic health, you can then rebalance your own brain chemistry, and often quite quickly, sometimes within just days to weeks.
And you mentioned oxidative stress, and that also was my next question. What is oxidative stress, and what causes oxidative stress in the brain?
Yeah, so, like we were saying before, we used to really be focusing, the biology of psychiatry was really focused on these three chemicals in the brain. But really the past 20 years or so, the field of psychiatry has been focusing on more recently discovered root causes of mental health problems, and these are especially inflammation of the brain and oxidative stress inside the brain. The third one is insulin resistance, which we're going to talk a lot about. I'm sure we've already talked about it. But inflammation, people kind of have a sense for what that is. Oxidative stress, most people don't really understand what that is. And we can kind of describe it very simply as these what are called free radicals, oxygen-free radicals, which are part of the immune system. When the brain is under stress, the cells of the immune system inside the brain will release these oxygen-free radicals to deliberately create oxidative stress. And oxidative stress is like an alarm that goes off in your brain that says, we have a problem, we need help, come and help us, right? So it's an immune signal. So oxidative stress is very good when you need it. But you don't want your alarm system to be going off all the time. You just want it to be going off when there's an emergency. Now, the problem is that these oxygen-free radicals, if they are allowed to persist, if you have oxygen-free radicals being generated all day long and all night long, it's very damaging to the brain. These oxygen radicals are very reactive and they damage everything they bump into. So it can physically damage the structure of the brain, and it can also destabilize brain chemistry. So oxidative stress is too many of these oxygen-free radicals being released too often, and often in an uncontrolled fashion. And all you have to do to make that happen is eat the wrong way. So if you eat the wrong way, you can see too many oxygen-free radicals released into the brain, which is very damaging. And diet's not the only thing. Smoking can do this, drinking alcohol can do this, and being exposed to environmental toxins can do this. But the biggest the biggest reason why most of us have too much oxidative stress in our brain and the rest of our body is because we have the wrong information about what a healthy diet is supposed to look like, and we're living in a food environment that is flooded with really dangerous foods that promote oxidative stress.
What is neuroinflammation and how does it contribute to an anxiety and psychiatric illnesses in general?
Yeah, so we're very familiar with the concept of inflammation in the body because if you have inflammation in the body, things become red and swollen and sore. And you know, okay, oh, my wrist is inflamed or my knee is inflamed. You might even have a headache, and you might think, okay, well, there's the lining, there are areas around the brain that are inflamed. The fascinating thing about inflammation inside the brain is you can't feel it and you can't see it. The brain doesn't turn red. It doesn't hurt because there are no nerve endings inside the brain. So you can't feel the pain of brain inflammation. Instead, what happens is your mental health will suffer. You may become depressed. You may become anxious. You may have difficulty concentrating and remembering things. And we see that pretty much every mental health disorder, if you look for inflammation, you will find it. And it's difficult to measure inside the brain. If you come to my office and there's no test I can give you in my office that says, oh, your brain is inflamed. But there are simple tests you can do in the body to look for these markers of inflammation, signs of inflammation. And if you have inflammation in the body, you will also very likely have inflammation in the brain as well because everything is connected.
Are there foods that are directly linked with neuroinflammation?
Yes. So the most important one for people to know about are the refined carbohydrates and the vegetable oils, the so-called vegetable oils, which are the refined fats. So refined factory carbohydrates and factory fats. So if you're following whole foods principles, this is a lot less likely to happen. But if you're not, and most people now around the world are eating foods that no longer come from farms and fields and fisheries, they come from factories. And they are usually very high in refined carbohydrates like sugar and flour, and refined fats like vegetable oil, for example, soybean oil, sunflower oil. And these are processed, these are industrially processed ingredients. And so the way that the refined carbohydrates can lead to inflammation and oxidative stress is by causing glucose levels to run too high inside the brain. And so if your glucose is running high inside your body, refined carbohydrates are very good at that. Refined carbohydrates are very good at causing high blood sugar levels. Um, then when the blood sugar is too high, the brain sugar will also be too high. They rise and fall together. They're not identical, but they are in proportion to each other. So the more glucose in the blood, the more glucose in the brain. And that's not good because the brain only wants to have a small amount, only needs a small amount of glucose. And if you give it too much, there'll be this excess glucose. The brain doesn't know what to do with it, doesn't need it. So it sticks. It sticks to vital components inside the brain, like proteins and lipids and even DNA molecules, and makes them sticky. And then they become dysfunctional and they don't work anymore and they start to accumulate inside the brain. And this is what starts that alarm system going off, the immune system going up, saying, we have to get rid of these sticky clusters because if we don't clear them away, brain cells won't be able to communicate with each other very well. So this is why the immune system is overactivated, trying to get rid of these. These are called advanced glycation end products. They're just sticky clusters of dysfunctional proteins and other components inside the brain. So that will set off waves of inflammation and oxidative stress inside the brain whenever your glucose level runs too high. And most people now have glucose levels that run too high after meals.
Can neuroinflammation be reversed with nutrition alone?
Yes, it depends on what's causing it. So if the inflammation inside your brain is being caused by high glucose levels, it is very, very quick. You can really very quickly get your glucose levels in a normal range within days to a couple of weeks if you have the right information. And most people don't. And that's why I'm glad that you have your channel, because
Thank you.
we need people to understand. We need doctors and nurses and therapists, and all medical health professionals, but also individuals and families who might be listening. We need them to understand how critical this getting your glucose levels into a healthy range is. It's not just about diabetes, although that's very important. If you have a blood sugar problem, you don't just have, if you have diabetes, you don't just have a blood sugar problem, you have a brain sugar problem. And so it's very, very important to get those glucose levels down. And it's simple. The ideas behind how to do that are very simple. I'm not saying it's easy, because you do have to make some changes, which can be hard at first, but you have tremendous control over your glucose and insulin levels.
Other than nutrition, what are other major drivers of neuroinflammation?
Yeah, there's research going on. If you look for relationships between other types of foods, if you go beyond the refined carbohydrates, you can see, for example, the vegetable oils. So the vegetable oils are they again sort of concentrated. The refined carbohydrates are concentrated sources of sugar that are really difficult to find in nature. Same with the vegetable oils. There is a small amount of this fat called linoleic acid. There's a fatty acid in that's quite high in many vegetable oils called linoleic acid, an omega-6 fatty acid. This is a naturally occurring fatty acid. You find it in small amounts in all kinds of foods, animal foods and plant foods, nuts and seeds and meat and chicken and so forth. But small percentage of the fat, small percentage of the food is linoleic acid. A bottle of vegetable oil can contain very high amounts of linoleic acid that the body was never designed to see. And this research is very, very early. We still don't really understand exactly what the risks are by flooding our system with very high amounts of linoleic acid. But some of the early research is concerning because, for example, I put in the book this research study that showed that linoleic acid does get absorbed by the brain, but then what the brain does with most of it is it burns it for energy. And you don't want that to be happening. The brain is not supposed to be burning long fatty acids for energy, because when you're trying to chop a very long fatty acid up into small pieces to turn it into fuel, there's a lot of oxidative stress that's happening in that process. The longer the molecule is, the more oxidative stress you're going to need. Oxidative stress is not just part of the immune system. Oxidative stress is also a normal part of digesting food and turning food into energy. You can't break food molecules like glucose or ketones or fat into energy without creating some oxidative stress. So some amount of oxidative stress is unavoidable. So, but these long fats, like linoleic acid, the brain should not be burning those for energy. It's designed to work. It works best when it's burning small molecules, and that keeps the oxidative stress to a minimum because it doesn't have to do as much chopping up. So linoleic acid and from vegetable oils. So refined carbohydrates and vegetable oils are the signature ingredients of processed foods. So if you look on the label, you will almost always see either sugar, flour, vegetable oil, or all three. And so, but there are other foods that can cause inflammation. Dairy, for example, for some people can be inflammatory. Really, any food that you have a sensitivity to can cause inflammation. You kind of have to be in touch with your body and kind of see which foods agree best with you. There are chapters in my book that help you understand which foods are the most likely to do this and which foods you don't need to worry as much about. but it's largely about, if my opinion is refined carbohydrates, refined vegetable oils, and dairy products.
And other than food, do we know any other drivers for neuroinflammation?
Yes, so environmental toxins. So living in a polluted
Mm,
environment, air pollution, water pollution, heavy metals, to all anything that the body is overexposed to, that can trigger inflammation inside the body. So, and then of course, injury and
mm,
infection, these can cause inflammation as well, viral infections,
yes.
um, those kinds of things. So there are many different ways to cause inflammation. But I think most people know that, yes, you shouldn't, you don't want to expose yourself to heavy metals or toxins or lots of pollution or smoking,
Yeah.
right? But I think what a lot of people don't realize is that just by eating cereal for breakfast, you can be causing a lot of inflammation inside the brain. That's where I think people don't have that information.
And how does what we eat affect the way we think and feel?
Yeah, I mean, the what we eat affects every cell in the body. The cells care. Every cell in the brain and body cares what you eat. All the cells are trying to do is they're trying to get the nutrients they need, and they are trying, and then they are trying to and then they are trying to serve you by functioning at their best. And every cell is a different job. And in order for it to do its job properly, it needs to be nourished, protected, and energized. It needs all the nutrients that you're supposed to get from your food. It needs to be protected from damage, protected from inflammation, protected from oxidative stress, and it needs to be properly energized. And that means most of that is about keeping your glucose and insulin levels in a healthy range. Because if your glucose levels are running too high, then your insulin levels will be running too high. And the higher your insulin levels go, the more insulin resistant many of your cells will become. And cells need insulin to function properly and to energize themselves. So too much glucose, not enough insulin, the insulin starts to not work very well. It has to work harder and harder and harder.
Yeah.
The more insulin resistant you become, and cells start to, this insulin resistance in the body is the cells are trying to protect themselves from being overstimulated by insulin. The body doesn't like anything in excess. So the right amount of insulin is good. The right amount of glucose is good.
Yes.
But too much glucose is bad, too much insulin is bad, too much of anything is bad, too much
Yes.
water is bad. So, there are lots of, we want to make sure that we are living our lives in balance,
Yes. Everything in balance, right?
everything in balance.
Can food addiction cause or worsen psychiatric disorders?
Oh, yes. So food addiction is a very common problem. I think a lot more common than even the research is showing. I think most people now are dealing with some level of an unhealthy relationship with food, and it's not really with food. It's with non-foods. It's with these factory foods.
Yeah.
And at least I believe that whole foods that are well suited to human biology, meat, seafood, poultry, eggs, even nuts, vegetables, fruits, whole foods that we have been eating for 1 million, 2 million years. I don't believe that those foods are, I don't believe that they are inherently addictive.
Yes.
Um, the problem is that, again, most of our food now comes from factories. These cause these foods do not behave like food in the human body. And so if you eat something that's very high in sugar or flour, you get this steep spike in glucose that's very unnaturally steep, and steep spike and steep drop, and that triggers a whole cascade of hormonal and brain chemical reactions that put you on a roller coaster for the rest
Yeah.
of the day. And it can feel like you're unstable from within, emotionally unstable. you're craving, you're hungry, you're tired, you're irritable, you can't stop thinking about food, and you're on this road. So the glucose goes up, the glucose comes down, and all you're trying to do by eating more carbohydrate is trying to stabilize this. But it's a very unstable way to live. And so it's really, really important to step off that roller coaster and at least begin by following whole foods principles.
Yes, and this processed food and the sugar is structured in a way that is very addictive.
It's true. And then you had asked about, how do these ingredients create an addictive relationship? Is that, when we eat these foods that we were not designed to eat, we were never designed, we did not evolve, to see these concentrated sources of sugar, for example, 3, 4, 5, 6 times a day. Those foods are processed differently and they blow past your hormonal stop signs. They your natural hormones that tell you, oh, I've had enough food, it's time to stop eating, I'm full. Those hormones do not respond normally to these abnormal foods. So
Mm.
these foods actually make you hungrier and can be harder to feel satisfied. And this is why people are eating multiple times per day, even at night, right before they go to bed. They wake up in the morning hungry. That's not normal.
Mm.
And so we are unbalanced from within. And when you eat the right way, you can start to trust your appetite again because your hormonal signaling system will be working better.
How do you approach patients with addiction plus another psychiatric illnesses?
Yeah, so the work that I do is I mean, the people who come to see me at this point in my practice are coming to see me for nutritional interventions, not for medication interventions, although many people who come to see me are taking psychiatric medications and other medications, and their hope in many cases is to try to reduce the amount of medication that they're using, maybe even come completely off medication. And so they're coming to me for nutritional intervention. The problem is I could explain to somebody in one meeting what the right way is to eat. But that doesn't mean it's easy to make that change. And
Yes.
so, one of the cornerstones of my work is the ketogenic diet. And the ketogenic diet is a very low carbohydrate diet. There are other things you need to do as well, but one of the first step to getting into ketosis is reducing your carbohydrate down to around 20 grams per day, depending on who you are, but somewhere, 20 to 50 grams per day. That is 6 times less, at least 6 times less than most people are eating now, carbohydrate. So it's a dramatic reduction in carbohydrate. That's at first, for the first few days especially, very difficult to do. It's almost like you're going through a withdrawal from this addictive ingredient. You're getting off that roller coaster. It doesn't feel good at first, but after a few days, when you're on the other side, everything starts to quiet down and you feel so much better. It's like stopping alcohol. I mean, nobody says that stopping alcohol is easy at first. It feels terrible the first week or so, but it gets better and better and better. It doesn't mean that alcohol is good for you. It just means that, that the process of removing it from your body is challenging. And so the food addiction, especially carbohydrate addiction and sugar and flour addiction, these are really powerful. And a lot of people cannot even imagine a day without bread or without cereal or without sugar. For some people, they've been eating this way ever since they were a very small child. And it's really tough. And so people without food addiction make these changes relatively easily. People with addiction to these carbohydrates, it's much tougher. And even when they make that change in the beginning, even if they feel a lot better, they often will slip back, multiple times per year. because these ingredients are so addictive. So when I'm working with people, I'm working first to try to help them make these changes in their diet and then help them sustain these changes in their diet. And it really is the addictive relationship with these carbohydrate ingredients, which is the biggest challenge for people.
ADHD diagnosis is very vague. What are strong indicators that someone has ADHD? And is it how to know is it true ADHD or a pattern of ADHD or misdiagnosed as ADHD?
Oh my gosh. Uh, it it's a very good and complicated question
Yes.
because I mean, really, you could ask this about any psychiatric diagnosis. Um, Attention problems, you see attention problems in all kinds of mental health problems. So if you have depression, it's hard to pay attention. If you have anxiety, it's hard to pay attention. If you have memory problems, you'll start to be able to lose your focus and ability to be productive and effective in your life. So schizophrenia, PTSD, lots of things will disrupt your ability to direct your focus where it needs to be. And so it's very common for people who come in for help to have attention problems. So then how do you know it's ADHD and not something else? And so this is part of the doing a very careful evaluation is figuring out, okay, well, does this person have symptoms of another condition? Or does this person have a substance use issue that they're struggling with because substance use can disrupt attention as well. So you have to look for all the other, maybe they're taking a medication that's affecting their attention. There are many different causes for attention problems. But if we're thinking about something that's more like a pure ADHD, I mean, textbook pure ADHD, it's really not an attention deficit. So ADHD stands for attention deficit hyperactivity disorder. Not everybody has hyperactivity, but only some people do. But the attention piece, it's called attention deficit disorder, but I don't like that name because we all know that people with attention problems, even who have been formally diagnosed with ADHD, they can pay attention to certain things. They can pay attention to certain things for days. And so it's not that they don't have enough attention, it's that they can't direct their attention where it needs to be for as long as it needs to be there. They can't control where it goes. And so what happens is if you need to get some work done, or if you need to take care of a family member, or you need to get something done that might not be fascinating, might not be exciting, might not be new or interesting, it's going to feel boring to you. You're going to procrastinate. You're not going to do it. You're going to start it. You're not going to finish it, or you might never start it. And so your life begins to fall apart because you cannot function and get things done. And you have to be able to get things done in life. So in my view, the hallmark of attention deficit disorder is executive dysfunction. You can't get stuff done. And that starts to really make you feel bad about yourself. And it starts to wreak havoc with your relationships at work, at home, at school. And so, because people can't rely on you to be able to take care of what you need to take care of, you can't meet your responsibilities. So, and people with ADHD are much higher risk for substance use, much higher risk for suicide, much higher risk for divorce. It's a very serious condition. And all it really is the brain is not functioning properly. And so the research in this area is very new. We still don't really understand the relationship between metabolic health and ADHD. I'm involved in a study that's about to be launched at Oxford University. The principal investigator is Allie Houston, um, and uh, and that is going to be the first study in the world to look at whether a ketogenic diet could be helpful in adults with ADHD and depression. I'm really excited to see what this study may help us understand. So this is very, very new research, but I can tell you in my clinical practice and the clinical practice of many of my colleagues, we see all the time that people with attention and executive problems, people with brain fog, people who aren't productive enough, people who have been diagnosed with ADHD, we see all the time that if they change their diet, especially in these particular ways, that they can see their symptoms improve very quickly. And there have been quite a few studies in children with ADHD. These go back several decades now. Most of these studies were conducted in Europe, where they took kids with moderate to severe ADHD and they changed their diet in this very particular way. It wasn't ketogenic. It was a balanced diet, carbohydrates and proteins and fats, but it was a very simple diet. It was called a few foods diet, where there's maybe 7 or 8 foods, things like, lamb and chicken, turkey, and vegetables and fruits. Unfortunately, some margarine and some apple juice, but that's okay. It was mostly a whole foods diet, but very, very simple. It didn't contain any wheat. It didn't contain any dairy. It didn't contain sugary foods. It was, and 2/3 to 3/4 of those kids, when you look at every study, had about the same rate. Between 2/3 and 3/4 of those children responded beautifully to this diet within just a few weeks. So we know that diet makes a huge difference in ADHD. We just need more research to understand what is it exactly, what dietary changes are the ones that are most important to make in ADHD.
And why is it very vague and difficult diagnosis? Is it, do you agree that it's difficult diagnosis to establish, and the criteria to diagnose can be anything really? They're a bit non-specific. And is there a way like to confirm the diagnosis?
There's no way to confirm any diagnosis in psychiatry.
Yeah.
We have no tests. We have no objective tests, biomarkers, blood tests, imaging tests that we can do in psychiatry to tell you, oh, you have schizophrenia, you have ADHD, you have major depression, you have bipolar disorder. We have no idea. It's very different than the rest of medicine, where there can be very objective markers for a particular problem. I measure your blood pressure, it's too high, you have hypertension. Your blood pressure doesn't tell me why your blood pressure is too high. It's usually because you're not eating correctly, but at least there's something I can point to and show you and say, here's the problem, your blood pressure is too high. In psychiatry, we do not have this. So even though we have been thinking about mental health problems as chemical imbalances in the brain for 75 years, there's no test I can give you to find out whether or not you have a chemical imbalance in your brain. I am guessing at that. And then I'm guessing to figure out which medicine might be the most helpful to you. I mean, that's the way I practiced for 10 years. That's the way I was trained to practice. And because there's no better way to do it. But there wasn't anyway. And now what we have is, okay, let's look deeper. And you don't need to open the brain up and look inside to be able to know what's going on, because the brain is connected to the body. And if you do simple tests in the body, then it gives you lots of information about what's going on in the brain. So if your glucose levels are running too high in your body, they will also be running too high in your brain. If your insulin levels are running too high in your body, and this is a little bit backwards, they're going to be running too low in your brain, because the higher your blood insulin level is, the more insulin resistant your brain is going to become. It's going to be harder for insulin to cross into the brain. So high blood glucose, high brain glucose, high blood insulin, low brain insulin. That tells me a lot. I can also measure certain markers of inflammation in your bloodstream and tell you whether or not you've got some inflammation, too much inflammation in your system. And for example, I can look at your lipid panel, your cholesterol panel. everybody pretty much has had a cholesterol panel because everybody worries about LDL cholesterol. And most doctors, the way they practice now, they get your lipid panel and they zero in on that LDL, and that's all and they never look at anything else. And they say, oh, your LDL is too high. That's going to put you at risk for a heart attack. Let's prescribe a medicine to bring that cholesterol down. That's a very unfortunate way of thinking about the cholesterol panel because there's so much information on that cholesterol panel that's so much more important than the LDL. So your triglycerides, you want your triglycerides to be nice and low, and you want your HDL cholesterol to be nice and high. And there's no medicine for those things. So that's about changing your diet to improve your metabolic health. So I do some very simple tests in my work. I have fasting insulin level. I still check fasting glucose and I still check hemoglobin A1C. I don't, but those fasting glucose and fasting hemoglobin and hemoglobin A1C, those are tests for type 2 diabetes. If your fasting glucose is too high, you're already in serious trouble metabolically. But your fasting insulin level is a much more sensitive, earlier marker for problems to come down the road. And your lipid panel is a much more useful marker than your fasting glucose and your hemoglobin A1C. Because what you want is you don't want to know if you already have type 2 diabetes. You want to know if you're on the wrong path. And if you're on the wrong path and you're heading for type 2 diabetes or pre-diabetes, and this can take 10, 20 years to develop, you want to turn the train around now before things get really bad. I mean, it's never too late to do this, but it's also never too early. You want to start as early as you can to really be as healthy, your brain and body to be as healthy as possible for the rest of your life starting now.
How do you approach when seeing ADHD? Do you start by identifying the subtype, or do you try to address the lifestyle factors, like you said, or do you go straight for medication? There are some psychiatrists who say when ADHD is always solved by medication.
Oh my goodness. So the tricky part of this is that ADHD medications work fairly well. So many people, not all people, but many people will benefit. Their symptoms will improve very quickly with stimulant medication. Now that there can be side effects to stimulant medications, and not everybody responds to them. And a lot of people become quickly tolerant to them. So you have to take breaks from them periodically so that it won't stop working. But ADHD medications, the stimulants, these are the brand names in the United States. I don't know what they are in the UAE, but the brand names are like Ritalin and Adderall and Dexedrine and Vyvanse. These are all basically various versions of so for example amphetamines. So these are stimulants, and what they do is they signal the brain, they stimulate the brain to release more dopamine and more norepinephrine to stimulate your attention circuitry. And they do work well in many people, and they work right away within about a half an hour. So if
Hmm.
you take a stimulant in the morning, you within about a half an hour or so, depending on which one you chose, you can start to function a lot better. The problem with these medicines is that, well, first of all, they can cause a lot of anxiety for people. And they can reduce appetite. So like in children and teens, they can lose their appetite, then they're not eating enough, they can lose too much weight. But also it overstimulates the nervous system. People can feel really tense, anxious, jittery, irritable. And the other problem is that, they don't last very long. So later on in the day, the medicine drops off and all your symptoms come back, and you can actually feel really tired. You can have kind of a crash as the dose wears off. So it's an artificial, unnatural way of stimulating your brain to work better. If you change your diet in the right ways, you can get the same benefit, but without all the side effects, and a much more even. You help your brain work better 24 hours a day, not just for a few hours while the medicine is in your system. I worked for 2 years at a specialty ADHD clinic, but I also worked for 13 years in college mental health. And many college students come to the psychiatrist on campus to say that they have ADHD, they can't concentrate, they can't study for their exams, they can't get anything done. And so they're hoping to get a stimulant medication. And so if they were coming to me, I would first do the evaluation, find out if I thought they actually had ADHD or whether they were just looking for a stimulant because sometimes students just like to take stimulants. And sometimes students, I mean, there's so many students now that take stimulants that students without ADHD feel like there's an unfair advantage and that they're trying to compete with students who are taking stimulants. So they want the stimulant too, to be able to stay up late at night and work and get more things done. Of course, that makes sense. So, and sometimes students were selling stimulants to other students, so that it's really complicated culture. But if you come to me, the first thing I'm going to try to do is figure out, do you really have ADHD? One of the best ways that I found to do that over the years, because it's not easy, it is not easy to figure this out. One of the best ways I have found to figure that out is to go back, take a really good history going all the way back to childhood about executive function. And so asking questions like, what was school like when you were a little kid? Did you used to get in trouble a lot? Were you good at keeping your room clean? Did your parents used to get frustrated with you? Like, and I wouldn't ask these specific questions. I would just say, tell me about what was school like for you when you were a kid? Or tell me, what was it like growing up in your family? And then just listen for clues to executive function problems. Because most people would say that true ADHD, and we can argue about whether or not that is even such a thing, but that true ADHD is supposed to begin in childhood. We used to think that it needed to begin by age 7. So I used to take my history and go all the way back. So tell me about kindergarten, first grade. What did life look like for you back then? What kind of a kid were you? And that sort of stuff. And that would really help me a lot. But another thing that would help me a lot is asking other people in the family or friends, like what it's like to spend time with this person, try to get things done with this person, because it can be very frustrating to try to work with or be in a relationship with somebody who has severe executive dysfunction.
Is there a concern when using stimulant medication that it might worsen metabolic health, like hypertension, for example, because they do raise the blood pressure and the heart rate, and if someone is dealing also with anxiety, the sympathetic nervous system will go higher, and that will put them at a higher risk with hypertension?
Oh, that is such a good question. Wow. So yes, all medications have side effects. All medications interfere with normal human biology. And just as you said, the biggest problems with stimulants are that they fire up the sympathetic nervous system. They put your body in fight or flight mode, and your stress hormone levels go up. So your blood pressure can go up, your appetite can go down, your blood glucose can go up. And this is interesting because you might think, well, why would your blood glucose go up when you take a stimulant? It's because those stress hormones are telling your liver that there's some stressful situation occurring, and therefore you need some fast energy, emergency energy to deal with this, whatever the stressful thing is. And this is a very ancient response system designed for real emergencies, like you're being chased by a tiger. And so these stress hormones tell your liver to make glucose, break down the starch that's stored in the liver, chop it up into glucose, and send it out into the bloodstream. So you can see the glucose level go up in response to drinking caffeine, taking stimulants. Stimulants and caffeine have a lot in common because these stress hormone levels go up. And now the funny thing about stimulants is that yes, they can raise your blood pressure. Yes, they can raise your blood sugar, but they also tend to, in most people, not all, reduce your appetite, and that lowers your blood sugar. So there's this balance. It depends on the dose, it depends on the person. Some people, their metabolic health will improve on a stimulant, other people it will not. And so it's a really interesting and complicated question. So for example, if you start somebody on a ketogenic diet and they're taking a stimulant, they can quickly feel overstimulated and lose their appetite completely because now they've got the stimulant reducing their appetite and they've got the diet reducing their appetite. And the diet is also stimulates the brain to work better. So the medicine can start to feel too strong. And that's a good thing because that's a sign then you can maybe lower the dose or take the medication away entirely and let the diet do its thing. So I love the question because it speaks to how complicated the relationship is between medications, metabolic health, and mental health.
What do you recommend for your patient that who are dealing with anxiety, other than changing their lifestyle? Do you recommend them meditation, journaling?
Yeah, so anxiety, in addition to the lifestyle changes, the autonomic nervous system, like calming the autonomic nervous system, is not just about manipulating your body chemistry with foods and medications. I mean, the brain is paying attention to every aspect of your environment, including what you're thinking about, what you're listening to, what you're watching, who you're spending time with. Where you are. Are you spending enough time in nature? Are you getting enough sunlight? Are your relationships healthy? Are in loving relationships support community, spiritual connection? All of these things are extremely important to the health of the human being, the human mind, the human spirit. We are not just robots that need the right chemicals, in our systems. And this is one of the beautiful things about, being a human being is that we have many different ways of influencing our brain and body chemistry, not just food and medications, but all of the other, as a colleague of mine likes to say, your diet of influences. So what are you taking in? What are you seeing? What are you hearing? Music, sport, uh, community, spiritual practices, nature, exercise, all of these things are very important. Sleep, sunlight, all of these things are signals to your brain that you're either in a calm and peaceful and safe place or that you're in a stressful and dangerous place. And so even just listening to a lot of negative news, for example, can, which may have absolutely no impact on your daily life in your area, it can fire up your system and make you feel that there's an unsafe situation, and your body and brain will change its chemistry to try to deal with that stressful situation, even though it's not directly affecting you. So I love that question.
Do you recommend journaling, like
Uh,
writing your? Mhm.
Yeah, so for people who enjoy that, right? So I found journaling extremely helpful to me when I was younger, especially dealing with stressful situations, trying to sort out relationships. Some people are more introspective, and some people do better talking to other people about things, and some people do better writing and thinking on their own. I was more of an introverted person, so I loved writing about
Uh,
my feelings and sorting them out. But some people do much better if they're externalizing those feelings and talking with somebody else about them.
Just do you recommend if someone start journaling to write their thought process, their emotions, their daily activity? How do you think journaling would be helpful for someone who's about to start journaling?
Oh, I love, like I said, I found it so useful. I don't think I could have gotten through my teenage and young 20s without journaling. And because it's a way to stop and be reflective. And especially for people who have never done it, just sitting down in front of a blank page and whatever comes out and don't judge it. And it doesn't have to be every day. It doesn't have to be just whatever is just, it's a kind of a meditative practice where you sit and just whatever comes, you write it down without judging it or trying to control it. And that's a way of getting in touch with your innermost wisdom. Because sometimes, especially depending on your personality structure, there are some people who might think, well, I, journaling is supposed to look like this. I'm supposed to write about these things every day, and this, and but that's not, that won't bring you to your inner wisdom. You have to just let whatever comes out onto the page without judging it, let that come out. And do that, start a practice, do that for a month, right? Every day for a month, just a little bit. And then if you miss a day, it's fine. Don't worry about it. Just do it the next day. It can even be one sentence. And it gradually gets you in touch with yourself, especially these days where our attention is so fragmented and we've got lots of streams of information and people we don't even know coming into our minds and into our hearts. There's a lot of noise. And so if you sit down ideally in a beautiful place, a peaceful place, and just write whatever comes to you, you'll get to know yourself better. And the better you know yourself, the better decisions, the healthier decisions you can make, the wiser the decisions you can make. And you notice connections, patterns between how you spent your time that day and how you feel, what you ate that day and how you feel. Journaling was critical to me when I was trying to figure out my own health issues in my early 40s. I was keeping a food and symptom journal. I was writing down how I felt each day and what I'd eaten that day to look for those connections. But it doesn't have to be about food. It can be about any aspect of your life that's important in your day-to-day life.
How much of psychiatric illness do you believe that is genetic and biologically driven, and how much of it is our lifestyle?
I think it's really a soup of all of those things. And so, of course, there are certain problems that run in families that we're more vulnerable to. Um, and in even biological problems that we're more vulnerable to. So, for example, um, if you and I eat exactly the same way and do the exactly same amount of exercise and we're exactly the same age, um, if we eat exactly the same wrong diet, if you and I both wake up in the morning, we have a big bowl of cereal for breakfast, we have a sandwich and chips and pizza for lunch, and we have a big bowl of pasta for dinner and ice cream and cookies and cake and soda. If we both eat the same way, we are probably going to develop very different diseases. And that's because we're different. We are biologically different. We are genetically different, but we're still both in trouble because we're vulnerable to different things. So what runs in your family is different from what runs in my family. But the way that we are the same is our cells have the same basic requirements. Our cells need the same nutrients, they need the same protection, they need the same energy flow. That's the same for all human beings. We are much more alike than we are different. And if you have those human rules for nutrition, all humans, the rules are the same for all humans. It's just the way that things go right for us is the same for all of us. What we all need is the same. The way that things go wrong for us, that's where it's different. And so if you play by the right rules, then you really minimize your risk for whatever the vulnerabilities are that happen to run in your family. So it is this combination of environmental influences and biological vulnerabilities.
What are some nutrients that are essential for good mental health?
So all of the essential nutrients are essential. And that so all of the B vitamins, iron, so vitamins, minerals, essential fatty acids. The essential fatty acids are the omega-3 fatty acids, EPA and DHA, which can only be found in animal foods. And The omega-6 fatty acid, arachidonic acid, also only found in animal foods, although it's easier for us to make that one, from other things. So we have essential fatty acids. We have vitamins, vitamin A, all the B vitamins, vitamin C, vitamin D. Vitamin D is best obtained from sunlight. Vitamin E, vitamin K1 and K2. And then we have minerals like iron, and copper and magnesium and calcium and sodium, and zinc. So, and this is not a complete list. And then so you've got and then you have these other interesting molecules, things like carnitine and creatine, and so there are this mixture of micronutrients. These are the molecules that we need in small amounts. We are designed, we evolved to obtain these micronutrients from food, not from supplements. And you can use supplements in certain cases, it's important, but you really want to start, ideally, you want to try to get as many of these as you can from food. And so the brain needs these just as much as any other organ does. In fact, some of these the brain needs more of than the rest of the body because the brain is one of the organs in the body that requires the most energy. It's a very high energy electrical organ. To make all that electricity, it requires a lot of energy. So even though the body is only 2%, the brain is only 2% of the body's weight, it requires 20% of the body's energy. So 10 times more than you would expect for an organ of its size. And turning food into energy, you need more micronutrients, things like B vitamins and magnesium, many of the things that we just talked about. And the other thing is that the brain, this electrical organ, there are these synapses, these connections between brain cells where the neurotransmitters like dopamine and serotonin are being passed back and forth. The membranes that surround the brain cells that create those synapses are made from membranes. Those membranes must have the right mixture of fats, and that's where the omega-3 fatty acids and omega-6 fatty acids come into play for the correct structure and function of those synapses. So, and cholesterol. We make our own cholesterol, but cholesterol is a fundamental component of those membranes and those synapses. So there you need all those micronutrients, and the brain needs some of those more than others, iron, zinc, magnesium. But then you also need the macronutrients. You need protein, amino acids to make those neurotransmitters. Many of them are made out of amino acids. And then you need a source of energy. And you can fuel your cells with carbohydrates or fats or both. And what you decide to fuel yourself with is going to depend on your metabolic health, your goals, how well you tolerate carbohydrate, which many of us don't tolerate well anymore because we kind of broken that system. So if you've got the right micronutrients, if you've got the right amount of protein, high quality protein, right balance of amino acids, the best sources are animal foods. And then you've got a source of energy that's not going to um, cause metabolic damage. So the right fats or carbohydrates for your personal metabolism.
Do you like or recommend any supplements?
I only recommend supplements when indicated. So I always like to start with a good, nutritious food plan. And now this, as a physician, that this isn't always going to work for everybody. So, I mean, ideally, if all of us were healthy, and we all had access to the right foods and we all felt comfortable eating the right foods, those are big ifs, then you should theoretically be able to obtain all the nutrients you need from food. That's what our ancestors have been doing for 2 million years, getting our nutrients from food. Supplements are a relatively new invention. So about 100 years ago, I saw it. I think that's when we first, became aware of these micronutrients. So pretty modern thing. But the problem is the reason why supplements are still have a place, is that Not everybody has access to nutritious food. Not everybody feels comfortable eating the most nutritious foods. There are some people who no longer feel comfortable eating animal foods like meat, seafood, poultry, eggs, um, for various reasons. And there are some people who have health issues that interfere with their ability to absorb nutrients from food. So in those cases, then a supplement can be very useful. And so that's the way that I practice, but there's no one right way of doing this. Everybody draws the line in a different place. Some people start right off with lots of supplements when somebody comes in the office, and other people are more conservative about it. And I definitely put myself more in the conservative camp.
Do you believe that people should talk to a psychiatrist or psychologist during stressful period or during hardship, or just to optimize characters and traits that aren't necessarily pathological?
Yeah, I think this is a question of personality, culture, and availability. So some people do very well talking about problems in psychotherapy. Others, it's just really not the best way for them to deal with problems. Not everybody can access psychotherapy. Even people who can access psychotherapy can't always find a good psychotherapist because the fit between the therapist and the patient is critical. Lots of studies have been done on this, looking at, well, which type of psychotherapy is the most effective type of psychotherapy. There are many different kinds of talk therapy, cognitive behavioral therapy, psychoanalytic psychotherapy, many different types. And what these studies show repeatedly is that it's less about the type of psychotherapy and more about the relationship between the therapist and the patient. So if that's a good fit, it's usually helpful, even if the type of psychotherapy is one that doesn't even have a lot of evidence behind it. It's the fit between, and it's that human connection, right? So the human connection is what's healing. So for some people, it's the psychotherapy relationship. For some people, it's a community, spending more time in community, spending time with groups of people who share your ideals and your values, and talking about things in a group. Um, and uh, and for some people, it's more looking inward, as we were talking about before. And there are some cultures where psychotherapy simply isn't part of the culture. And the good news is that it doesn't have to be. There are many other ways to meet that need for human connection and support and expression that don't involve formal psychotherapy.
What are the best foods and the worst foods for the brain?
So the best foods for the brain, the food. So we were talking before about how really what all cells need, the rules for human nutrition for cells are very simple. Nourish, protect, energize. The cells need all the nutrients, the cells need to be protected from damage, and the cells need to have their energy needs met in a way that doesn't damage their metabolism. So nourish, protect, energize. So which foods are best at that? Which foods check all of those boxes the most easily? They are the non-dairy animal foods. These are meat, seafood, poultry, and eggs. And that is upside down from what we are usually told. We are told that these foods are the most dangerous for our health, and the opposite is what is biologically true. So, and there are other foods that can meet these needs. It's just harder to do it. You can, you can, you can. There are certain plant foods that can meet some of your nutrient needs without without risking damage to your cells and without damaging your metabolism. It's just harder because plant foods, there are no plant foods that contain all of the nutrients that we need. And many plant foods, not all, but some are very high in carbohydrate, like the starchy vegetables, for example, for example, potatoes, and fruits. These foods are, for some of us, no longer safe because for some of us, our ability to tolerate and process carbohydrates safely while keeping our glucose and insulin levels in a healthy range We no longer, we've lost some of that capacity. So these foods originally may have been healthy for people, but for many of us, they're risky now, unfortunately. So um, so the foods that are best at serving those goals are the animal foods, the non-dairy animal foods, and the foods that are riskiest to our brain are the refined carbohydrates like sugar, flour, cereals, fruit juices, and the refined vegetable oils such as soybean, sunflower oil, safflower oil, cottonseed oil, etc. Um, and I mean those are the broad strokes. And I would put one other thing is that whole foods, if we're thinking about whole foods, if you had to pick a category of whole foods that is most dangerous to the brain and the body, it is grains, wheat, corn, oats. The grains are really not well suited to human biology.
And what about legumes?
Yeah, legumes also, legumes very problematic. The reason why I would put greens in an even worse category than legumes. So I would say if you have the option of avoiding grains and legumes, avoid them both. The reason why I put grains in a worse category than legumes is they do not contain the amino acids that legumes do. Legumes can be a really important source of protein amino acids for people who either don't have access to nutritious animal foods or who prefer not to eat animal foods. People who are following vegetarian and vegan diets, for example. And so the legumes are really critical, staple foods for people who don't eat animal foods. They're more nutritious. Um, and so even though both of these foods are risky to human health, the legumes are important for certain groups of people to keep in their diet. But there is really no reason, unless you have access to no other source of calories, there is no reason for anybody to eat a grain.
About seeds like chia seed, pumpkin seed, flax seed.
Yeah, so seeds. So there's a chapter in my book called Grains, Beans, Nuts, and Seeds. Um, and it that goes through all of the different risks and benefits of these foods. So grains, beans, nuts, and seeds are all just different types of seeds. So grains are the seeds of grasses. Beans are the seeds of leguminous plants. And then nuts are the seeds of trees. And then seeds like pumpkin seeds, cheese, these are seeds. So the seeds of fruits, for example. So all of these are seeds of different types. And seeds are the most nutritious part of the plant, but they are also the most heavily defended part of the plant because seeds contain the embryo inside, the future generation of the plant, and the plant wants to protect that embryo until it comes time to sprout. So um, that that seed naturally contains defensive molecules to protect the embryo against elements like weather and wind and water and rain and heat. And it also contains defensive molecules to protect the seed from predators, things like insects and fungi and worms and people and animals. And so these are toxins and anti-nutrients. Anti-nutrients to hold on to the nutrients for the embryo, making it harder for us to access their nutrients, and toxins to deter us from wanting to eat these foods again by making us feel unwell. So the reason why grains are at the top of this list in terms of danger to humans, um, I would grains, I would put legumes next, and then the nuts and seeds they're a little bit better. They're a little bit better than these other categories. They're more nutritious in a lot of cases, in some cases anyway, but they're also we've been eating them for a lot longer in our evolutionary history. You don't need to cook nuts in order to eat them without becoming sick. You do need to cook legumes and grains in order to eat them without becoming sick. They are just more toxic. And so the nuts and seeds, depending on the type of seed, some seeds are quite toxic, but nuts and seeds are they because they have shells, for example, and because we've been eating them for so much longer, they don't, in many cases, have as many defensive molecules in them as the grains and legumes do. So nuts, for example, have a very, very hard shell that helps to protect them from the elements. This is one example. So in my book, I give people the information about these different foods so they know the real risks and benefits, rather than the ones you hear all the time about, oh, the more grains you must eat whole grains, the more seeds and nuts you eat, the better, those kinds of things. That's not biologically accurate. That's ideologically, those pieces of advice come from ideology and guesswork and theory, not from biology. So if you look at the biology of those foods, it becomes very simple to see what's going on. And then you can decide for yourself based on the real risks and benefits that we already understand so much about. Okay, what agrees best with you? What are your personal goals? What are your preferences? And what is your metabolic health? Can you tolerate these foods well? Um, and especially digestively, some of these foods are quite difficult to digest. But how does your blood sugar do with legumes, for example? Let's say you prefer to follow a vegan or vegetarian diet and you need to include some legumes in your diet. That they may help you with your nutritional goals, but what if you can't digest them well and so you don't feel well after you eat them? So just like being aware of these issues so that you can personalize the diet to your health goals and your preferences.
And what is optimal level, do you think, for ketogenic status for someone who's measuring?
Oh, yeah. So ketogenic diet. So I spend a lot of my time using ketogenic diets in my practice, teaching other clinicians how to use ketogenic diets for mental health treatment because there are some special things you need to know to be able to do this safely. And speaking about ketogenic diets and writing about them. So the biggest question I get about ketogenic diets for mental health is how high do my ketones need to be to treat a mental health condition? And the answer is the first answer is we don't know, but the second answer is it depends. And the third answer is aim for this range and most people are going to do well. So and so it varies. So we don't have enough research to tell us what the ideal range is. Even if we did, I predict that it's going to depend on the person
Yeah.
because that's what I see in my clinical practice. Some people, their ketones don't need to be very high, others they do. I think it varies a lot. And the third piece is that most people, and this comes from clinical research as well as clinical practice, most people are going to do well when they aim for keeping their blood ketone levels on a blood meter
Mhm.
somewhere between 1.0 and 3.0 millimole most of the time, as much of the time as possible, including when you first wake up in the morning, right? So the more time you're spending in that range, the better you will usually do. And so that's a great place to start. Now, if you do that for 12 weeks, a good 3 months, and you're feeling a lot better, in many cases you will be feeling a lot better, then you can, if you want, decide if you want to see what's possible on the outer edges of that range. If I went higher, would I feel even better? If I go lower, will I stay well? Like how much carbohydrate can I get away with? And so, and as human beings, we naturally experiment with things to see what we can get away with, right? And so most of my patients, even when they're doing really well in a particular range, are going to start after a while to play with that a little bit and see where they really need to be. And so, but the best advice I can give if people are starting a ketogenic diet, first of all, learn more about it. Don't just start a ketogenic diet, especially if you're taking medications, especially if you have a history of any serious symptoms of mental health problems or if you have any medical conditions, this is a very powerful metabolic intervention. So you need to work with somebody who knows what they're doing, learn more about it. But most people are going to get pretty good results if they aim for that range for the first 12 weeks. Um, if you're much lower than that, you might get frustrated and not see the results you're hoping for, and you might think it doesn't work. If you're too high, it can actually feel uncomfortable. For some people, it can make people feel more anxious, not sleep well, irritable. It depends on the person. So between 1 and 3 is comfortable and potentially useful for the majority of people.
And how often should they measure in the beginning? And do you start to gap it out later on? And do you feel that state if you're out of ketosis and in ketosis?
Yeah, so fantastic. Yeah, so once people get adapted, like once the cells throughout your brain and body become comfortable and adapted to burning ketones and fatty acids, a higher percentage of ketones and fatty acids and a lower percentage of glucose. So most people are walking around burning mostly glucose most of the time, and they're not burning very much fat or ketones most of the time. The cells are like hybrid engines. They can burn both fuels, and it's the mixture that matters, right? So most of us are walking around like this, burning mostly glucose. Where an optimal, I would argue, metabolically optimal is really more like this, where most of the time you're burning mostly fat and ketones and you're relying less on glucose. It's not zero glucose. You still need glucose, but you're relying on it less. And that's good because this is a more sustainable fuel. It burns more cleanly, more efficiently, with less oxidative stress than burning glucose. So you flip this upside down, and then it takes your cells a good 6 to 12 weeks to really get good at this. And so and this is part of the reason why you want to be in good consistent ketosis for 3 months, at least 6 weeks, 6 to 12 weeks, or you want to be in consistent ketosis so your cells get good. They get practice. They have to change their internal machinery in order to be really good at this. They have to change their enzyme pathway. They build new molecules. It's like they're changing. You're really fundamentally changing your cell's operating system. So give it time, and then as you say, you can start to feel that. So in the beginning, you measure your ketones. I recommend people measure their ketones at least once a day in the beginning, first thing in the morning,
Mhm.
before you exercise, before you eat. And that gives you your nice clean baseline for how you start your day. And if your ketones are too low in the morning, wait and don't eat until they're in a better range. Because if your ketones are low, your insulin is high and you're burning carbohydrate, and that's not where you want to be. So if your ketones are low in the morning, you want to wait before you eat and wait until you see those ketones come up on that meter before you think about and this is the beauty of intermittent fasting. This is the beauty of skipping breakfast. It's a really simple and effective strategy for improving your metabolic health. It's just don't eat breakfast.
Yes. And
Unless you're underweight.
do you have any thoughts on intermittent fasting or skipping meal with ketosis?
Yeah, so intermittent fasting is a really powerful strategy, A, for getting into ketosis, and B, for deepening ketosis or getting back into ketosis if you've fallen out of ketosis. So, and for a lot of people, it's just good practice to spend less time eating because most of us are eating far too often. Once or twice a day is plenty. We do not need to eat more than a couple of times a day. And if you're eating the right way, you won't be hungry in between meals and you will be getting what you need from your food. But because most of us are eating the wrong way, we're hungry all the time and we're not getting all the things we need. We're getting all kinds of things we don't need. So, yes, intermittent fasting, making sure that you're not being a food processor all day long. You've got to give your cells a break from processing food because every time you eat, you're creating oxidative stress. It's unavoidable. It's part of how cells create energy. There's some oxidative stress involved. And oxidative stress is one of the root causes of cellular damage and mental health problems. So the fewer times you can eat, the better. And intermittent fasting is a great way to do that.
And do we know why the brain prefers glucose as the source of energy?
Oh, it doesn't. So yeah, so it needs some glucose at all times, but it doesn't need very much, and it actually prefers to burn a mixture of glucose and ketones. So this is what has been shown in work by, for example, Professor Stephen Cunnane at the University of Sherbrooke in Canada, who studies brain metabolism and aging. And what he has shown is that if you give brain cells the option, if you surround brain cells with plenty of glucose, but also plenty of ketones, that cell will choose to burn a mixture of the two. It will not choose to burn 100% glucose, even though it could if it wanted to. And this shows you that the cells, I mean, cells are smart, they know what they need. It shows you that that the brain was not, uh, a lot of people think of glucose as the ideal fuel source for the brain, that the brain would want to burn. If glucose was the best fuel for the brain or for all brain cells, why would it even have the capacity to absorb ketones? And if you're giving it plenty of glucose, why would it choose to burn a mixture of the two? And when you look at the biology of it, it becomes very clear that both of these sources of fuel have their advantages and disadvantages. And so the ideal state for the cell is to be taking advantage of both of these fuels. So glucose, it burns faster than ketones. And for some cells and some pathways, that's what you want. And so ketones burn more slowly. And so you don't want the whole brain to be running on ketones because then certain pathways wouldn't run fast enough. But you also don't want the brain to be running entirely on glucose because glucose creates a lot more oxidative stress. And it's a lot more damaging to run entirely on glucose. So it's about finding that balance, right? The right mixture of fuels. So there are certain pathways in the brain that cannot burn ketones because ketones are too small to fit into the pathway. And so that's why the brain cannot run 100% on ketones. At best, more something like two-thirds of the brain's fuel demands can be met by ketones, but the rest ideally comes from glucose so that all of your pathways are functioning optimally.
And do you think there is anything, doctor, that we didn't cover and you would like us to include? Anything important you think I should ask you or add?
I have to say, the questions have been wonderful and really thorough and far-reaching, and it's been a lot of fun to talk with you. We were talking before you started recording about, how you became interested in metabolic health and practicing this way. Is there something you can share with maybe people who are aware of my work but aren't aware of your work? And if they come and watch this video, like, is there something you can share with them to help them understand what it's like for you to practice this way where you are and what you've seen and why you're excited about this?
In the incidence of metabolic diseases, hypertension, diabetes, high cholesterol, fatty liver disease, and are all rising globally. In our region and globally, I think this is not a coincidence. I think all of the constant insult on the mitochondria through food, through environmental toxin, through stress are behind these. And what we can control the most is the things we eat.
Always love hearing about other physicians who are using these principles in their work because we need as many people in the world to be doing this as possible. So
And could you tell us more about your book and where can people find it and where can people find your work as well? I can see your book behind there. Change your diet, change your mind.
Yeah, yeah. So the book is Change Your Diet, Change Your Mind. And it really is the reason I wrote it is to give people hope about mental health, to show them how much more control they have over their mental health than they have been led to believe, and how powerful this connection is between your food choices, your metabolic health, and your mental health. And it includes lots of information about food, lots of information about nutrition science, but also a lot of information about mental health and especially ketogenic diets, paleo diets, and carnivore diets, and how you can use these and personalize these diets to try to improve your own mental health within, in many cases, days to weeks. You can see really dramatic improvements in your symptoms. And so I put as much information in the book as I could to uh, help people begin to think about this differently, and lots of practical information as well as science. So I hope that it's useful to people, and as you can see, it's being translated into many other languages, and I would love to be able to find a publisher interested in translating the book into Arabic. So the people can learn more about this work through my website. It's called diagnosisdiet.com. So you can learn about my clinician training program, Ketogenic Diets and Mental Health. You can look for a clinician to work with you or collaborate with you. And I have a free clinician directory on my website where you can find practitioners of all disciplines around the world who use ketogenic diets to treat mental health conditions. And then there's all kinds of, free articles and videos on the website if you're curious to learn more about any of these topics.
Yes, well, we'll link all of those in the description and here as well. And it's been an honor to speak to you. I'm very happy we had you on the show.
I'm really honored to have been with you. Thank you so much for inviting me.